On the other side of the city, oh. On the other side. On the other side of the city, oh. On the other side. There is someone special, special to me.
Well, I guess it's therapy. I was an airline pilot. I was very pleased with my life. I had just been promoted to captain of United Airlines. And suddenly I had what they call a cardiac event. I was shopping one day. I had chest pains. I did not have a heart problem, but I had an aneurysm that was, they call dissecting, and I ended up in the hospital. And 7 days later, I woke up and I had been operated on. And they had repaired the aneurysm, but they had also replaced the valve, and it cost me my pilot's license, so I needed to find a new life.
Your hometown awards, whatever that is.
That's kind of a big deal.
Oh.
Facing the issues, number 2. Because of the trauma of the operation, I guess, it affected my brain. There was some question whether or not it would ever come back full function. I remember I finally went home, and the therapy, what would you call them? Occupational therapist, a lady would come once a week and visit me, and the speech therapist, who is another lady, would come and visit me once a week. And they would talk about things that I should know. And I knew, for instance, what still sticks in my mind, that I didn't know my multiplication tables. I didn't know what 7 times 6 was. For 20 years, I was a pilot with Pan American World Airways, and my job as the 3rd pilot in the cockpit was to calculate, among other things, fuel. And if you left for San Francisco to go to Tokyo, you flew 12 hours over the Pacific Ocean. It was my job to make sure that that airplane had enough fuel on board. The more you use a calculator, the more things you do in your head. And I was very comfortable at multiplying 3-digit numbers in my head because it was faster than using a calculator. This is what I did for 20 years. As soon as you see it roll, fade. Okay? You see what I'm saying?
No, talk to me again.
Okay. He says, we'll pause now for this announcement. When he says that, you're going to fade to black. Then we're going to hit the button, and you look up here. When you see it up there rolling, then you hit the button again and fade up. When they sent me home, the 2 therapists just were there. I don't know where they came from. And they would visit and talk and then leave and come back and give me homework to do. I remember one of them was teaching me my multiplication tables, which I needed to know. Obviously, I was very upset that I couldn't do that. One woman kept encouraging me and telling me how my brain was recovering, and the other one kept cautioning me how I was still terribly handicapped, and I had to realize this. And I could not let people rely on me. I could not assume responsibility. A Naval Academy graduate, I was in the Navy for a lot of years, and I had a lot of responsibility, and people for whom I was responsible. What I want to do is go with the first story first, and then what I do after we get the first story. Okay, we need the bars. Yeah, up there.
Yeah.
Okay, whatever you like. Bars and tone, thank you. If we had to be in a war, I would have been directly responsible for the lives of people. And that kind of rang through when the doctor had said, you can no longer let anybody rely on you. You cannot be responsible. And that hurt a lot. In an effort to find a way to measure my capability to read and write, I took a correspondence course at Northern Virginia Community College and, to see if I could communicate with writing to a teacher as just another student. And that seemed to work out. It reassured me a little bit. And American University had a program, and I talked to the people, a counselor over there, and the one thing she said made sense to me is that if I had a motivation, if I had a goal, such as a master's degree, it would help motivate me to study and to do the work that I needed to do. To go back to graduate school and then start with kids that were 30 years my junior was just frightening. Once I got into the scenario, once I got settled in, I found it very comfortable. And I found academically that I was able to do it, which was the reason that I went. I needed to know that. I needed to know that I could assume responsibilities. My position among everybody else in the world and back to where I was, that my brain had sufficiently recovered from the injury. Once having graduated and got the degree, of course, the industry doesn't come to you in television. You kind of flounder around, and the next thing that you need is some sort of experience. And Channel 10, which is cable access, gave me the opportunity to get the experience, to get the hands-on, big equipment, things that I could never afford. And suddenly I'm in a television studio with cameras, with crew, with CG and the audio and switchers and all the electronic paraphernalia that goes with it. It's mine, and I don't have to pay for it. Once I got sick, the American Medical Association pretty much took over, and I did what the doctor told me to do. I had never really been sick before, so it was all I had experienced. As far as healing my brain, I believe that absolutely, as long as I had the capacity to read and to study and go back to school and improve the injury, learn those multiplication tables, that I should do that. I do believe that we should maintain our health. I did that. I maintained my weight, I maintained my alcoholic intake, my cholesterol. I ran, I jogged, not because I liked to jog, I hated it when I started, just so that at older age I could still fly airplanes. I don't know if this is your definition of self-healing. You can recover from that. You can get better, and I did. And I learned going back to school. And I know that 7 times 6 is 42 now, and I don't know if I can still calculate the fuel to Tokyo, but almost. I can do pretty much what I